Estes Park Medical Center works every day to serve our mission, to make a positive difference in the health and well-being of all we serve. 25 years ago, a small, dedicated group of community leaders committed to support this deeply meaningful mission by creating the Estes Park Medical Center Foundation. This insightful group knew the importance of quality healthcare and worked tirelessly to formalize philanthropic supports for the needs of Estes Park Medical Center.
I am Margaret Clark. I was born in Chicago and lived there most of my early life, and went to the University of Chicago, and came out here after my husband died. This has been just heaven to me out here. I always loved the mountains because we came when I was little, and started our first hiking when I was 5. A very wonderful thing for me to be out here in the mountains. Well, there was a great need for a hospital in the beginning, and when we got that, we discovered that it had need of a group that bolstered it up, that gave it some money coming in, because it was just a little hospital to begin with. So a group of men in the community, powerhouse men, decided to meet and make it happen, to have a foundation that would support the hospital. And they asked me, because I was president at that time of the Elizabeth Guild. They all had very great skills in many ways, and it was obvious what one would do the legal work, one would do something else and something else. And they looked at me and said, what do we have you do? You be president. I still remember it so clearly. That room was just crawling with energy, all up and down and sideways, and that's where they were organizing right from the beginning. And everybody knew what he had to do, so off they went and did it. Oh, it's a necessity to serve the community. It's done marvelous things for us, our whole family. How can you help but be grateful and work in whatever way you can to help the community? Well, I'm glad to see that little by little the foundation and other people who give money are providing more the equipment that is needed to make us a bigger hospital. And I love the way it has been reorganized. I think it's just been great. I'm doing rehab up there 3 times a week, and it's just cardiac rehab, and it's just great. So I'm proud of it. I don't know any specific things we need, but I know that there still are some, and I want to be part of any effort to provide those.
Hello, I am Robert Austin, the Chief Executive Officer of the Estes Park Medical Center. The Estes Park Medical Center is a 25-bed critical access hospital. It also has, with the services we provide, a 60-bed skilled nursing long-term care unit. We have 2 home health agencies, a hospice, a family medical clinic which comprises of 8 multi-specialty physicians. We have a specialty clinic, and we operate our own ambulance service. So it's a really, truly integrated health system here in Estes Park. Our mission, which was just approved a day ago and revised, was to make a positive difference in the health and well-being of all we serve. Our vision is to achieve a culture of clinical and service excellence through patient-centered care. That really does signify what we do here, because our emphasis is on the patient. And the patient and the family are the family-centered care that we so well focus on here. The medical center provides high-quality care. We score extremely well in our Avatar patient satisfaction scores each and every year. and we provide the best in healthcare in northern Colorado. We work closely with the Estes Park Medical Center Foundation. I consider them part of our family, and I will tell you that the Estes Park Medical Center Foundation is critical to the success of the Estes Park Medical Center. They have been our partner for many years, assisting in raising money for the emergency room addition that we just completed 2 years ago. I'm excited about this because we're at the forefront of healthcare in the nation in terms of what we do here in Estes Park. It is with the assistance of the foundation that we're able to be at this forefront. We have modern, updated equipment. We are in the process of purchasing all new digital imaging equipment, including a MRI, a CAT scanner, and digital mammography, which will bring the digital imaging department into the 21st century. And we are just excited to be able to offer these services to our community. So we appreciate the support from the foundation to help us in these endeavors. On behalf of the entire staff, physicians, and volunteers of the Estes Park Medical Center, we all offer our congratulations to the Estes Park Medical Center Foundation on 25 fabulous years of being in existence and helping our local community support the Estes Park Medical Center. So congratulations.
My name is Cynthia Crumey, and I live here in Estes Park. I've lived here about 7 years. I have used the hospital facilities for standard checkups and things for all those years, and more recently, however, I had an opportunity to use the emergency services in a way that surprised all of us. I believe I have the opportunity to talk to you today because of what was done for me on the morning of April 3rd at the Estes Park Medical Center. I went down to my room to get ready for the day and began to have a heart attack, of all things. I never expected it. I have no history of heart trouble. Certainly don't have any of the risk factors that I was aware of or am aware of now that would have prompted me to have this. But I did fall to my knees having a heart attack. My husband heard the commotion, called 911. Within about 11 minutes, the ambulance crews were there, EMTs were there, and that's pretty remarkable in itself because there was a snowstorm, like a blizzard by that time, and we live on a 1.5 mile dirt road up the side of a mountain. The EMTs took care of me, they stabilized everything, they were in discussion with the emergency room physician here at the medical center the entire time, and pretty soon, within a matter of minutes, I was in an ambulance on my way to the medical center. I believe I stayed in the Estes Park Medical Center for a grand total of 18 minutes, during which time Dr. Chu saved my life. As a patient, going into an emergency room, when you know that something is very wrong, I really did feel as if I were dying, and my perception was pretty correct. The medical room itself, you go in and there are lights everywhere and there are lots of people, and my main perception of it was that everybody was doing something for me. And then he administered the medicine. I was popped back in an ambulance and on my way to the Heart Center of the Rockies after that. But without the medical center's intervention, I wouldn't have made it to that ambulance. Without Dr. Chu's sage wisdom and his very serious intent telling me that this is what I have to do, I followed his instructions because I believed him. And I think that anytime I would go into the medical center, even before, but now even more so, I have the feeling that if someone tells me something that they think is the right thing to do, that I can give it careful consideration and I can trust the wisdom of the doctors and nurses and staff there. And that's of course very comforting when we do live in a pretty rural environment, and it would not be so convenient to have to drive down the mountain every time you wanted to get some consultation of some sort. So I'm a big supporter of the medical center and certainly of the ER. The ER sees, in the summer, I'm sure, hundreds of people a day. As far as I could tell while I was there, I was the only person in that room who mattered to all of those other people. That made me feel a sense of hope and optimism, and they made me better. As far as I'm concerned, after the experience I had recently, I know for a fact that the medical center people and the staff saved my life. It was just a life-saving, life-changing event, and I'm very grateful.
Well, we moved to Estes Park in 1987, and I first became aware of the hospital. I was actually aware before we moved here, but wanted to work in the laboratory and went to work in the fall of '87 in the lab. And it's been a wonderful situation for me ever since. I did retire in 2006 after working there for 18 years, but it was always, as we talked about our job at the hospital, it was always our job and our volunteer job at the same time, because there were so few of us. Everybody had to kind of do everything. But that's what made it special, and that's what made it wonderful, because you have such wonderful contact with the community, your neighbors, your friends, and the people that you work with. It's been a wonderful experience. So of course it was a natural for me to go on the foundation board. Phil had been talking about it for a while.
My education was in business, so I could always just tell them what I thought, and I guess some of what I said must have worked.
Helped out.
Because then they decided that they would enlist my help on the board. And I'm finishing my 10th year. I
have to admire the foresight of the original members of the foundation board, because they set $1 million for the endowment as their goal. They had a very wonderful long-range vision for the foundation, and they accomplished that. And that has made a large difference in the equipment that the hospital is able to purchase. For a small institution to be able to have the sophisticated and expensive equipment that's necessary, it would just be impossible without the foundation. So Phil and I, are dedicated to doing whatever we can to help in that regard.
I think most philanthropy is at some level kind of self-serving, and the hospital, very important for our business. It's very important for our community. There are so many people to whom we have sold houses who've made the comment that, we wouldn't move to a place that's as remote as Estes Park unless there was first-class medical treatment available. I don't believe I've ever heard from someone who thought that our emergency department didn't far exceed what they thought would be available here.
And we've found that to be true several times ourselves.
Oh yeah.
Hi, my name is Dr. Christopher Daly, and I'm the Chief of Staff at Estes Park Medical Center. I'm also an emergency physician in the emergency department and have been here for over 20 years. I chose Estes Park because, well, everything is here that my wife and I enjoy. And 20 years ago we came and thought we'd stay 2 years, and then the CEO talked me into a full-time job, and I'm still here. Now, I've loved working here. The staff here is wonderful, the employees, the nurses, the administration, but most of all it's the patients that I get a kick out of, and I just love working. Unfortunately for you, I think I've treated everybody in town, but fortunately for me, it's been a pleasure taking care of each and every one of you. Throughout the years, I've seen significant changes to the hospital. Not just the physicians that are now here, but also the infrastructure and the services provided. A lot of that could have never happened without the Foundation's help. We partnered with them, and through them they were able to get the funds to help rebuild and remodel the entire hospital. Also, we listened to the community. They felt that the emergency services was one of the most important things that we provide here. And so a new emergency department was rebuilt 2 years ago. That was because of the foundation and your generosity and philanthropy. Every day I treat patients. I am lucky to be here in such a great facility, and the patients are lucky to have a facility to come to that gives them the very best quality care that they could get. This kind of philanthropy and generosity not only benefits the hospital, but every single community member and every patient we see, whether they're a visitor passing through the park or they're here for a weekend from the valley. I see this every single day, and I personally have donated to the hospital, like you have, to help the community and all the patients that come to our valley. I want to thank you for your previous donations to help the hospital and the foundation build such an excellent facility. Happy 25th anniversary to our foundation. I look forward to the next 25 years.